Bariatric surgery, as you know, is in a lot of cases high risk. Bariatric patients have different types of problems, including sometimes diabetes, high blood pressure, things that can predispose to heart disease. A lot of patients have severe sleep apnea. The statistics are that most bariatric patients have, about 90% of them have sleep apnea in some form, either mild, moderate, or severe. Those issues have to be dealt with as well. And so the typical tests, besides the normal routine tests, some patients might require a heart test. Some patients are heart tests in terms of stress test or an angiogram, however the cardiologist wants to sort that out. Some patients may require a scope, where we put an esophageal gastroduodenoscopy, where we put a scope actually inside the mouth and look at the stomach and see if they have any other gross abnormalities that will sort of preclude them. Depending on the type of surgery, we find different things. If patients are positive for bacteria called H. pylori, that can lead to ulceration of the stomach and stress ulcers and things like that. So those types of issues should have to be dealt with. Some patients need that. Other patients are over the age of 50, and if they have not had a colonic screening, I think that is very important, because you don't want to do an operation for somebody who potentially has a cancer. The other things are routine well woman screening. In our clinic, we make sure that every patient within a year's time, 12 months from the time they have seen us at that first visit, before their surgery, has a routine pap smear, breast exam, and if age appropriate, mammography. All of our patients undergo a thorough psychological evaluation. Psych is an integral part of the support groups, as I previously mentioned. Psychologist, dietitian, and exercise. But every patient has to undergo a psychological evaluation, which is typically one-on-one with a psychologist or psychiatrist. In our program, it's a psychologist.